Hello everyone, welcome back to my YouTube channel. This is the third part of clinical research. In this video, we will discuss about how to brush with research methodology. In the recent year, there is a trend for attending workshops, conferences and meetings that attempt to teach research methodology to students. Without taking anything away from such attempt to our mind, this could orient someone to research. It is very hard to teach research to our students. It is a practical science that can be learned when we do things. A mistake that many of us do is to apply various tests knowing their strengths and weaknesses and not know their true spirit. There are several statistical tests are available to help research to draw valid conclusion about the sample that they have selected. Therefore, one needs to know about their methods, drawback and strength. However, until tests are used in practice, it is unlikely that they are going to be remembered for a long time. It is not necessary that every one of us will become high quality researcher, but research orientation definitely helps. Actually, a need was felt that the clinical research methodology should be made simple enough so that everyone who has interest in biomedical research is not handicapped by the lack of understanding or lack of technique into this vital discipline. We should make it clear right from the beginning to the students that it is impossible to dream of a good quality research without being aware of research methods and statistical techniques. Therefore, knowing research methods is needed. Awareness about research method and statistical techniques in India is not very high. There is no role of subjectivity here, and it's all or none. It is important to know that in diagnostic testing, sensitivity and specificity of the diagnostic test is calculated, and several other parameters depend upon the same. Sensitivity is the ability of a diagnostic test to be able to differentiate diseased from the healthy and give the number of people with disease. Low sensitivity would mean a large number of people with disease have been excluded. Lots of false negatives will be there. A specificity is the ability of a diagnostic test to find out healthy from diseases. Low specificity means the ability to separate healthy people from diseased is limited and there will be a lot of false positive tests. Research project when started need to continue with several things in mind. There is some characteristic of research that is systematic, logical, empirical, reductive, replicable. The outline of research processes are given. It gives gross differences between the basic and applied research from a student's viewpoint. For doing any kind of research, we have first a research process which is reviewed from available literature. From that available literature, we have to formulate a question that what we are going to do. Then we have to select a appropriate research design, which is also known as protocol for a particular research. Then we have to collect relevant data either from any published book or from any published paper. Then we have to interpret their finding and research on their finding. Then we have to publish finding. Before publish our finding, we have to ensure that the data or the research that we are going to publish is accurate, true, and not cut paste from other research papers. There is given a list of basic and applied research. Basic research is theoretical, more invasive, laboratory based, tightly controlled, lack external validity, focus on mechanism, and more reductionists. While On the other hand, applied research is quick answer giving, less invasive, consume less time, and it is field based, loosely controlled, externally valid, focus on effect, and less reductionist. There are several methods used in basic and applied research. Some of very commonly used methods in clinical research are given. Research methods can be qualitative and quantitative. There is difference between the two. Here is a list of quantitative research strategy and qualitative research strategy. That's all about today's video. Thank you.